To know or not to know, the ethical dilemmas that arise with the new blood test to diagnose the risk of developing Alzheimer's disease. As of 2014, there were 5.1 million Americans living with Alzheimer's disease, with rates expected to triple by 2050. Alzheimer's disease can begin to develop in the brain 10 to 15 years before symptoms are obvious, making it challenging to fight the disease as it has already damaged the brain. In 2014, a new blood test to help determine your odds of developing Alzheimer's disease was the main headline at every news channel, including NBC, ABC, and CBS. This test is approximately 90% accurate. Researchers found 10 facts in common on blood samples of people who later developed Alzheimer's disease. This blood test has the potential to alter treatment, allowing patients to start treatments much earlier before the brain damage has occurred. The medications have little benefit today because they're started too late into the disease progression. It is believed many clinical trials of Alzheimer's medications fail for this reason. Ethical principles are in conflict with this blood test. Autonomy, having the say-so about your own well-being, can be enhanced with this test. If tested positive, you will be educated to make advanced directives and wishes clear early on so that others can let you choose how you live. Beneficence, doing good, can be enhanced by early risk identification, which leads to early treatment. Non-maleficence, doing no harm, conflicts because positive test results could be harmful to one's present life now, leaving them traumatized and waiting for the day they succumb to the disease. Paternalism, when health professionals act as parent, conflicts with patients' autonomy. While you want to allow a patient their autonomy and give them the choice to take the test, your own professional values tell you that based on the patient's background, they shouldn't have the test as it could cause more harm to the patient now. The ANA Code of Ethics addresses several of the ethical obligations of the RN. Provision 1 covers the right to self-determination, in which patients deserve the right to choose end-of-life caring, which can be arranged at an early time if the patient knows they will be losing the capacity. Provision 3 relates to the nurse's obligation to the patient, whether educating the patient on the blood test or if they are involved in an Alzheimer's study, allowing them all rights associated with research. Provision 8 relates to the nurse's duty to advance health and human rights. Some patients would be better and healthier not knowing and living every day looking around for symptoms of dementia they begin to express. This blood test presents many implications on nursing practice. First, there is the uncertainty of diagnosis of the disease from the test. It only determines the risk of developing, and it is only 90% accurate. Next, it is suggested to have counseling when diagnosing someone with a progressive disease such as Alzheimer's. The blood test could benefit researchers in determining effectiveness in various Alzheimer's medications. The nurse has the opportunity to help and prepare a patient in making autonomous decisions about their future by setting up advanced directives early. Negative results will help decrease the stress and worries of people who panic when they occasionally forget things. Positive results could be detrimental, causing a sense of impending doom, anxiety, depression, stress, and preemptive suicide. They could also encourage people to turn lives around and try to be healthier in an event to halt disease progression. When this test becomes routine, nurses should use the 6-step process in ethical decision-making outlined in Bertillo and Doherty to determine if the test is ethical for each patient. First, gather all information about the test, its effectiveness rate, and patient's family history of Alzheimer's to develop risk level. Second, identify that this could result in an ethical dilemma, as there could be 2 right paths to choose if you and the patient disagree on what is right for them to do. Not both choices can be taken. Third, use the theories of beneficence and non-maleficence to weigh out the pros and cons of having the test for each individual patient. Allow them autonomy by including them in the decision-making process. 4. Before deciding to have the life-changing test, it would be essential to explore how things would be different if they chose the alternative, not having the test. 5. Completing the action would be doing the blood test and giving results to the patient. 6. We would evaluate the outcome by following up with the patient to see how they are doing after their results at various points.